You're listening to the Doctors In podcast from martinclinic.com. Although we share a lot of practical and, in our opinion, awesome information, what you hear on this podcast is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes. So enjoy. Hello, I'm Dr. Martin Jr.
I'm Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 193. So after a long hiatus, I'm back finally.
Welcome back. It was tough doing solo.
Well, you know, it's funny because I've done a couple of these by myself, and I always think that if somebody drove by and saw me, they'd think I was crazy just talking to a mic by myself. But, I listened to your episodes. They were very good. You handled yourself very well. Now,
the problem I was having was,
I could tell you didn't
getting
know if
my blood pressure up was based on whether it was actually recording,
which was funny.
Yeah, because at the end of the day, you know, am I just talking to myself, or is the thing actually recording me, right? So, and because I don't know anything about technology, I wasn't sure if it was working.
Yeah,
but
you were trusting it, and it worked. It was good. But now I'm back, and we have some exciting episodes coming up.
Yeah.
And today we want to talk about a report that we've written. The report is done. We're just kind of polishing it up a bit, and then we'll make the report available. And it's called The 4 Culprits of Heart Disease. And the idea of the report is quite simple, actually. It's that doctors have missed the mark completely on heart disease. For far too long, they've blamed it on cholesterol, even though statistically, 75% of people that have a heart attack have normal cholesterol.
Yeah, if not higher. Studies show even people taking cholesterol-lowering medication have really no higher mortality, right? They don't live longer. No.
They have way more symptoms because a lot of people have a hard time. You know, the most common symptom people notice on that is they don't feel well. They feel sore, painful.
Yeah, usually very tired.
Very tired. It increases your risk of diabetes.
Yeah.
Fact. Increases your
almost
risk.
by 50%.
Yeah, it's insane. Imagine taking a drug to help your heart. It gives you diabetes, and diabetes ends up killing your heart. It's kind of a funny thing. But trillions of dollars later, here we are. Heart disease still the number one killer in North America, despite the fact that the guidelines for statin drugs pretty much makes it that everybody after a certain age needs to take them. Blood pressure, same thing, was done on blood pressure. They lowered the number needed to be diagnosed with high blood pressure, making it so a large percentage of the population woke up one next day.
And they were diagnosed with high blood pressure.
The day before they changed the guidelines, they were fine. The day after, they needed medication. And again, a lot of people taking those medications have a hard time. They don't feel well. They get a lot of symptoms. Biggest one is fatigue. We see that all the time.
Well, and those are linked too. And I think we've done, I don't know if it was just a live video that I did or, no, I think it was a live video, but I'm not quite sure whether we did a session on what those medications, what it affects your cognitive in the brain in the long run. You know, that those people seem to be much more susceptible later on in life to have dementia and Alzheimer's, and that there seems to be links to a lot of medications, including blood pressure medications, that affect your brain in the long term, you know. So, you keep your blood pressure maybe down.
Well, it's funny about that also. There's a group of drugs that people get prescribed that when they are prescribed those medications, the doctor is pretty much assuming they'll be on them for the rest of their lives, right? You never hear a doctor say, "Oh, we got your cholesterol level down. Now get off the drugs." Yeah. No, it's better stay on them.
Yeah, I had a patient in this morning, and again, I go over all their medications with them, not to take them off their meds. I just want to know what they're taking. I mean, it's important. And this guy said, well, he had a stroke. So I said, well, okay, I knew what cocktail he'd probably be on. And I said, well, what were your cholesterol numbers? He said, my cholesterol is normal. And he said, by the way, ever since I'd taken that medication, I haven't felt well. I said, well, you should be talking to your doctor about maybe coming off of that one. He said, I did. But the doctor said, yeah, your cholesterol was normal, but we can't take a chance. But they just get into that mindset that once you're on, you got to stay on, even though if things got better, and again, in this guy's case, he obviously didn't get the stroke from cholesterol because his cholesterol was always normal. And the doctor even admitted, oh, no. He said, I'm just doing this as prevention. So it really isn't prevention, but unfortunately, we live in that system. And a lot of our people that are listening to us today know exactly what we're talking about.
And a lot of cardiologists would still, I mean, it's coming around, but a lot of cardiologists would still go through the cholesterol medications, the high blood pressure medications. They would still follow.
It's a cocktail, right? Here it is. You got to take it.
And they would follow that still to this day, even though research is swung the other way. Again, we've always maintained that your body is it needs cholesterol so much. It's so important that your body does not trust you to get it from your diet. It makes it on its own.
Yeah, exactly.
It is so necessary.
Yeah, but you can't live without cholesterol. Your cells are made up of it.
Even eating cholesterol doesn't have an effect on cholesterol levels. It's negligible.
Well, even making bile. Like if you think what bile is, right? Your body needs bile.
Yeah, it's
in order to absorb your nutrients properly and this and that. I mean, you don't even make bile if you don't have enough cholesterol. So, you're not even going to be digesting properly without cholesterol.
So what we want to do is talk about 4 culprits, we call them, that are better indicators than cholesterol for heart disease. Because, well, first of all, it's really not that hard to be a better indicator than cholesterol because for all intents and purposes, if they were relying on that, if you're relying to pick up cholesterol to detect heart attacks, that's a fail. That's a massive fail.
Yeah.
So we want to talk about 4 better than cholesterol culprits when it comes to heart disease. And these are really, in our opinion, this is what's behind heart attacks. Yeah. This is what's behind heart disease, clots and strokes and all those kind of things. So that's what we're going to talk about today. And if we don't have enough time in this episode, then we'll continue in the next one. But we'll definitely start breaking it down. So I'll name the 4 culprits, and then we'll go through each of them one at a time. So the 4 culprits are this: homocysteine, endothelial dysfunction, nitric oxide, and C-reactive protein. And we'll break those down, each and every one of them. Now, let's start with homocysteine, because it's funny. Very few people listening to this podcast will have heard the term homocysteine, yet it is honestly one of the most important things to watch out for when it comes to heart and cardiovascular health.
Yeah, I remember even, it's got to be it's well over 20 years ago, reading, I think it was a functional medicine doctor talking about the importance of homocysteine and checking for that, because if you're not clearing out your homocysteine,
yeah.
Right?
So let's talk
about that. But just what he was saying is that you need to look at that thing, because if your homocysteine levels are high, your risk of having a heart attack or a stroke are gone up. But I can't remember what he said back 20 years ago, what the percentage was. It was really high. And it was surprising because you almost never hear of that.
You never hear of it.
And you never hear of a doctor actually testing for it.
And for those that are listening that are not sure what it is, homocysteine is basically a toxic byproduct from normal amino acid metabolism.
Yeah.
And the analogy that we like to use is burning wood in a fireplace. So a byproduct of burning wood is smoke.
Beautiful.
And what the problem is that you need
that smoke to get out.
You got to clear that, right? Obviously.
Yeah.
So you can imagine burning that wood gives you all the warmth that you need, and that's a fantastic effect. You need that to take place, just like you need amino acid metabolism to take place. But a byproduct of that warmth that you get from the wood is the smoke, and the byproduct of amino acid metabolism is homocysteine. Now, the thing is, just like smoke in a fireplace, it has to get cleared. It can't get blocked in there, because that's when you start to run into some...
If your ducts get blocked up, right, in a chimney, one of the most dangerous things, and we live in northern Ontario, and some people actually heat their homes by wood, right? And, I mean, that's wonderful. It's a lot cheaper than...
but imagine if a vent gets clogged.
Exactly.
And then
you get
smoke fills your house.
That's why they pay more for insurance.
That's right. And the smoke fills your house. It can ruin all the smell. It can ruin everything.
Yeah, it's very dangerous.
That's the same thing that can happen inside your blood vessels when it comes to getting rid of homocysteine metabolism. And what happens is that they get the process to get rid of that toxic byproduct, it breaks down. And as a result of it, you start to accumulate this stuff called homocysteine. And then that gets extremely dangerous because that affects the ability of blood to flow through your blood vessels. And which is why homocysteine is a significant marker of heart disease.
Yeah.
It's a significant marker of heart disease. So that's one of the big things. Now, we'll talk about a couple of studies in a second. Just they found them interesting. But I don't think we can stress enough how much of an indicator this is for heart disease.
Yeah, you wonder if it's not the number one indicator.
Yeah, it'd be interesting to look at it.
You know, with your CRP and your C-reactive
well, especially
protein,
combining
we'll
these four culprits, which we'll look at.
Nitric oxide. These are all fascinating things because this is big time prevention that we're talking about today.
So what happens is that when you start to accumulate homocysteine, it actually starts to injure and irritate the smooth walls of your blood vessels, which we'll talk about next in the next culprit. So what happens is your blood starts to thicken. It increases the risk of clots. And from there, obviously, that could trigger heart attacks. That could trigger a whole bunch of things from there. Now, how dangerous is homocysteine? Well, again, as we said, it's a significant risk factor for heart attack. And studies have shown this, that people with elevated levels of homocysteine are nearly at double the risk of a major memory loss as well, because obviously you need blood flow to your brain.
Yeah.
So homocysteine not only kills your heart, but it can affect the health of your brain. And think of what that can do for dementias. Think what that can do for Alzheimer's. So there's a definite effect on the brain. But when it comes to the heart, too much homocysteine levels can increase your risk of a heart attack. And various studies have shown different things by about 300%. That's how dangerous it can be, right? And there was that large study that was done on U.S. physicians. It was done over a long period of time, and they used almost 15,000 doctors in this study, and they found homocysteine to be an independent risk factor for heart disease. Again, over and over again, homocysteine is a problem. When it starts to accumulate, it becomes a big problem, and then your heart's at risk and your brain's at risk. And we'll talk about also in a little bit how to fix these things or
help them out.
How you can help them out. Because what we're doing now is we're talking about four culprits. Then we'll talk about what causes the culprits. And then we'll talk about how to fix the culprits.
How to fix it. Yep.
All right, so the first one was homocysteine. Let's talk about the second one, which goes along with homocysteine, and that's something called endothelial dysfunction.
Yeah. What's the endothelial?
Yeah, and so the best way to think of endothelial, just like those Teflon pans, right? I guess back in the day, and a lot of people still use them, they use Teflon cooking because you never have to spray nothing, and everything slides right off of it.
Yeah. Nothing sticks.
Nothing sticks, right? So the inner lining
of your blood vessels
are Teflon-like. And it's meant for stuff.
They're supposed to be.
They're supposed to be. And things pass through. They don't get stuck to the lining of the walls, because if there's an area on the wall of your blood vessels that can get stuck, then things accumulate there, and that could cause some big-time problems. So you have this Teflon-like inner layer of your blood vessels, and that's called your endothelium. So the endothelium is just basically, just think of Teflon. That's what it's there. And your blood vessels are lined by it. Now, you have over 60,000 miles
of blood vessels
in your body.
Fearfully and wonderfully made. Isn't that incredible?
Your blood vessels, yours, can circle the globe. That's the distance of blood vessels in our bodies. It's incredible to think about it. And
isn't it 1.5 times around the equator or something?
It's
like
crazy. That? And what's even you'll pump 1 million barrels of blood in your lifetime. 1,800 gallons of blood go through your vessels each and every day. It's crazy how. Yeah. So you can imagine 60,000 miles of blood vessels. You need it to work well, because if you start to run into a problem in your endothelial layer, which is that Teflon-like layer lining, and things start to accumulate, well, that's when you start getting strokes and
even elevated blood pressure.
Blood pressure, absolutely, right? So you could see that's how important this endothelial layer is. Now, there's something called endothelial dysfunction, because what happens for various reasons is that inner lining gets damaged, and then it gets rough, and then things start to stick to it. Then the walls get weaker, and then you can imagine it can expand in a bad area. You know, it's like you look at, for example, a tire that blows out, or you see a bike tire when the lining got weak and there's like
little bulge,
in it, right? And that's what can happen to your blood vessels.
And that makes makes that tire how much more susceptible to a blowout or whatever, right?
And that's what endothelial dysfunction is. Now, how do you know if you have endothelial dysfunction? Because that's an interesting question. It's scary to think about this, but the Mayo Clinic, they did a study a while ago, and they found that a weight gain of only 9 pounds, the biochemistry and the metabolic stuff involved in gaining weight can trigger a form of endothelial dysfunction. So your blood vessel linings
are sensitive to that.
But they're so crucial to normal heart function. And again, we have 60,000 miles of this. It's crazy. And it's amazing how strong our endothelium is to begin with to cover all that area. But anyways, let's move on here. So if you don't have a healthy endothelial layer, and there are a lot of things that can damage it, right? Free radical damage is a big one.
Yeah.
Inflammation, which we'll talk about in a few minutes. So you have inflammation, you have all these things. Regardless, that inner lining gets in trouble, and then things start to accumulate. And it isn't homocysteine, it's all those things. So it's fascinating to think about. So that's the second culprit.
Okay.
Let's talk about the third one. And the third one is really interesting because the guy who discovered it, or the team, I think those 3 guys who discovered it, won a Nobel Prize for it.
Nitric oxide.
And that's nitric oxide.
Mm-hmm.
And nitric oxide is that little gas molecule that when it's released, it causes vasodilation. Now, vasodilation is just a fancy way of saying opening up, right? Yep. So the gas, nitric oxide, directly causes your blood vessels to open up.
Yeah. I remember when I think it was 1980 or somewhere around there when because when I was in school, we didn't even know what nitric oxide was. But one thing we did know in school is what nitroglycerin did. So it's that same principle. They didn't really know why nitroglycerin worked, like if they gave you that for angina. But think of what it is. Angina would be a spasm because of the lack of blood supply to the heart. The heart would go into a spasm. It would give you severe pain, and it wasn't necessarily a heart attack, but your heart was going into a spasm. They give you a nitroglycerin. I remember those days when they give you something in your mouth, let it melt in your mouth, or I think they use it in patches even today that you get. And what does that do? It just opened up your blood vessels, and within seconds, the patient that was getting angina would get relief, right? It would just take that spasm away. So think of nitric oxide by the same principle. That same molecule opens up the blood vessels. You got better blood supply, right? So we're big proponents. We've been talking about nitric oxide for a long time, that's important for your blood vessels big time.
Well, and also the effect it has, again, on your brain. So a lot of the things that we talk about, and just as an aside, that's good for your heart is also very good for your brain.
Heart and brain.
And so that a lot of times what's good for one is good for the other. And so the same goes with nitric oxide. Studies have shown the importance that nitric oxide plays even in your ability to remember things. It's fascinating. But I didn't know this as well, and as I was doing more research and looking at all the function of nitric oxide, it literally strengthens your bones from the inside out. Your bones need nitric oxide to be healthy.
Yeah.
And it's funny because you never hear that, right? I mean, again, people still talk calcium and we talk magnesium for bones and vitamin D3 for bones, but you need nitric oxide to be healthy, to have healthy bones.
Even in the inside of the bone.
And the problem is this, after the age of 40...
Even for your immune system, I think you need good
100%.
nitric oxide, right?
Yeah, 100%. You need it to be healthy. And your brain needs it to be healthy. Your heart needs it to be healthy. Your bones need it to be healthy. Your immune system needs it to be healthy. And even look at the effect that low nitric oxide has on men's health specifically.
Right.
There's a whole...
Sexually and...
There's a whole industry of erectile dysfunction that is a low nitric oxide problem.
Yeah.
And again, we'll talk more about the fixes coming up.
Yeah,
but first,
and even some of the causes of low nitric oxide.
And we'll go through all that stuff because it's all fascinating.
Yeah.
So nitric oxide, like we said, does a whole bunch of stuff that you need. And after the age of 40, nitric oxides normally, so it's normal,
goes down.
And as your ability to make nitric oxide decreases, then you start to run into a whole bunch of problems with your circulation, your blood pressure, your brain, and everything. Now, there are a lot of things that can cause nitric oxide to decrease faster than just age, and we'll talk about that coming up in a few minutes. But just keep in mind, as we age, nitric oxide naturally decreases. So obviously anything that would naturally boost nitric oxide is fantastic for health. So that third culprit, so we've talked about homocysteine, we've talked about endothelial dysfunction, we just talked about nitric oxide. Now let's just talk about that fourth one, which obviously is CRP, which is just a marker for inflammation.
C-reactive protein.
Now, inflammation, we've said this before and we'll say it again, is found in all disease. Doesn't mean it's the cause of all disease. Something causes inflammation, but inflammation is found in all diseases. And same thing goes with heart disease. If you have a heart attack or you have heart disease or you have a stroke, you have inflammation.
100%.
That's a guarantee.
Yeah.
It's what's causing that inflammation.
I always liked what you always said about inflammation. It's something I've never forgotten. It's disease like an infection almost, but without a fever, right? It's disease or a sickness without a fever. Because we used to look at disease. Well, you can imagine, go back, and then you look at most diseases when you went back were caused by infection, right? They had a fever and they got sick. And, that's very common. But inflammation is that without a fever.
It's the
right?
new fever.
It's the new fever, right? And you might
a lot of diseases have a fever, but it's not a fever, it's inflammation.
Yeah.
Which is why inflammation is the new fever. So if you had a bacterial infection, you had a fever. So you knew you had a bacterial infection. Now, if you have a disease or a chronic illness, how do you know you have it? Because you have inflammation. So inflammation is the marker in the body that tells you there's something going on, but also it's causing the issues. But something's causing that inflammation. And we did a video a while ago when we talked on our website. You can find it on Leaky Gut. And we talk about the 3 seeds of disease. Yeah. All disease, take heart disease, number one killer, reverse engineer it. Inflammation is present. Well, what causes inflammation? Well, there's a lot of things that cause inflammation. But the 80-20 rule, what causes 80% of the inflammation in people that have heart disease? One of 3 things: free radical damage, leaky gut syndrome, high circulating insulin. That covers 80% plus of people that have inflammation. If not more.
Absolutely.
And what we always talk about, add the accelerator. So inflammation.
Cortisol.
If inflammation is a fire, think of cortisol, the stress hormone, as an accelerant, throwing gasoline on that fire. And that's what cortisol takes something that's there and makes it much, much worse.
Yeah.
So inflammation is a powerful marker of heart disease, which is why there are studies that show the association between gum disease
and heart disease.
You ask a dentist what a good marker of heart disease, they'll tell you gingivitis.
Yeah.
Inflammation.
What's the connection? Exactly.
It's inflammation.
Now, I don't know if you know this or I've ever brought this up, but years and years ago, this is well over 20 years ago, there was a study that came out of Laurentian University, which is
in our backyard.
Right in our backyard, literally, right in Sudbury here, where they did a study on C-reactive protein and being a marker for heart disease. You know what the headline was? Here's the headline. This marker will tell you up to 7 years ahead of time whether you are susceptible to get a heart attack or not. That was the headline. I remember reading it. I mean, it was fascinating. Go back. I'm talking 20 years ago about the marker of inflammation. C-reactive protein tells you about something that is often very silent, because people think of inflammation, they think of pain, right?
Yeah,
I mean, if you got, my knees inflamed.
It is, and it's true.
Yeah.
I mean, inflammation is the source of pain, especially if it gets into the joints or the muscles. Yeah. But inflammation is so much more than pain.
Yeah, I like the idea of your signals. If you and I are doing hand signals we're just across the street from each other, you can see my hands and I can see your hands, and we're hand signaling, like whatever, right? But inflammation's like fog that comes in between us, and now you can't even see each other.
Can't communicate.
Can't communicate now because I can't see you. The fog's so
and that's
thick.
what happens. Cells communicate with messengers, and inflammation messes that up. It irritates them.
Yeah, because they can't communicate properly. With
Somebody
each
else
other.
was, and they gave a good analogy a while ago, and I heard this, and I thought it was interesting. It's inflammation is like throwing sandpaper between your cells. Irritates them, makes it mad. It just irritates everything.
Yeah.
It messes everything up.
Yeah.
So inflammation is a powerful marker of heart disease. Yeah. So when you take the 4 markers that we talked about, homocysteine, you throw that in with a messed up endothelial dysfunction, you add in there low nitric oxide, and you toss in inflammation into the mix, and you have the recipe for heart disease. You also have the recipe for a lot more than just heart disease, but you definitely have the recipe for bad things. And those are much better markers than cholesterol is for heart disease. It's not even close.
Yeah.
Those are the things that they should be looking for in a panel for heart health or for heart health in general, because those are the things that will give the clinician and the patient a much better indication what's going on
Absolutely.
at the heart level. So those are the 4 culprits. All right, we're out of time. In the next episode, we're going to talk about what causes the 4 culprits and what you can do naturally to help fight those 4 culprits. So we got some good stuff coming up in the next episode. So again, we want to thank you for listening and have a great day.
Thanks for listening to the Doctor is In podcast from martinclinic.com. If you have any questions, you can reach us at info@martinclinic.com. If you're not a newsletter subscriber, you can head to our website and sign up for free. We also have a private Facebook group that you can join. It's a community of awesome people. Finally, I do a Facebook Live every Thursday morning at 8:30. Join us again next week for a new episode.